We look all good?
Mm-hmm.
All right, well, thank you to everyone for joining us for the last presentation for now in the Mental Health Intervention Team series on stress and coping. We hope you all have benefited from the earlier presentations, and we are excited to talk with you today about fostering hope during difficult times. So Michelle just introduced us a little bit, but we'll introduce ourselves a bit further as we're new faces in the series. Again, my name is Emily Wingate. I'm one of the psychology interns on the mental health intervention team this year. In the final stretch of completing my doctoral program at the University of South Florida, pending the successful completion of this internship over the next week and a half or so, as well as my doctoral dissertation. So that's another thing in and of itself. Rachel?
Yes, and my name is Rachel Ogle. I'm also a psychology intern and an intern on the mental health intervention team this year, and I'm completing my degree at Michigan State University.
So we're excited to get to be the closers on this series. In our discussion today, we'll start by defining hope and talking about why it matters. Then we'll move into the importance of hope during difficult times and how that's related to resilience. And we'll conclude with some strategies for fostering hope. We'll break out into a little bit of an activity and conclude with some additional resources for you all. And first, just a disclaimer that the information that we'll present today is strictly educational. It's not meant to substitute for professional medical advice, diagnosis, or treatment. Okay, so before we provide you with a definition of hope, we wanted to just pause and allow you to reflect on what hope means for you coming into this presentation. You can take a moment to kind of just think about that to yourself, or if you're comfortable, you're welcome to share what comes to mind in the chat with others. I see renewal, possibilities. Absolutely.
All right, well, thank you all for thinking a little bit about what hope means to you. I see a lot of great responses here, and it's nice to see. So we often think about hope as a feeling of desire for something to happen, but hope has also been defined as a theory in the field of positive psychology. So according to hope theory, hope is the ability to clearly set personal goals, develop strategies to reach those goals through pathways, and be able to motivate oneself to use those strategies, otherwise known as agency thinking. So pathways thinking refers to a person's perceived ability to brainstorm solutions to meet their goals, and agency is the motivation behind that thinking. So all of these components are really needed for hope and for hopeful thinking. So people with high hope believe that they can adapt to potential difficulties and losses. They have ongoing personal dialogues like, I can do it and I won't give up. High hope people can also be flexible, so they may establish several goals in different areas of their lives, so relationships and career and different things like that. And people who have high hope are able to switch to another goal if something gets in their way. So we'll talk later about how we can use different strategies and interventions to build on and strengthen these different components of hope. All right, so hope may be confused with or considered very similar to optimism. Hope and optimism are similar in the sense that they're both thinking about the future and future outcomes. So really the key distinction here between hope and optimism is that optimism is this general mindset that positive outcomes will happen regardless of one's actions. So it's the belief that good things will happen maybe due to personal attributes, but also maybe due to luck or different things like that. So optimism is this general expectation that goals will be met, but there's less of an emphasis on our individual role and how things will work out. So this is different from hope, which emphasizes personal involvement in reaching our goals through that pathways and agency thinking. All right, so before we get any further, I think it's important to address really why we're giving this presentation today and why hope matters. So hope is important for everyone and it matters for everyone. There's been a lot of research that's looked at the benefits that individuals with high hope have compared to those with less hope. And there's also been research on the benefits of interventions that are designed to foster hope. So with adults, studies have shown that adults with high hope report generally higher well-being and self-esteem. They perform better at work and they even live longer. Studies that have looked at the benefits of hope interventions have shown improvements in life meaning and reductions in symptoms of depression and anxiety. So all very good things. Hope is also really important for children and adolescents as well. So in children, hope is also positively associated with children's well-being, as well as their perceived competence, their self-worth, and their life satisfaction. Children with high hope are also more optimistic and perceive themselves as capable of solving problems. So we know that in general, having hope leads to better outcomes for people, and there's all of those really great benefits. But how does hope matter specifically during difficult times? So people have different beliefs and values that guide how they live their lives, right? So we all have this set of our own fundamental beliefs that we rarely question. These are beliefs that really form our understanding of the world, ourselves, and the future. So for example, we have assumptions about why people think and behave the way that they do, beliefs about our relationships with other people, and our expectations for the future. And these beliefs are really important because they give a sense of reality and meaning. So a loss event is something that can shatter these beliefs or basic assumptions. A loss event could really be anything, like the death of a loved one, a traumatic experience, or we can even think about COVID-19 as a loss event. A loss event can be really jarring and painful, in part because it might shatter some of those beliefs that we had that gave us that sense of reality. So we can think about COVID-19 as a lost event because it has certainly changed our day-to-day lives, our jobs, and how all of us are thinking about the world and our futures. So we really wanted to present on this topic today because hope can be a useful way for us to move forward and reconstruct those beliefs.
So thinking about COVID-19 as a loss event brings to mind the concept to me of resilience. I wanted to pause here for a second and mention a webinar that I listened to recently where the speaker was asked to describe disaster resilience. And she prefaced her discussion by saying that where she lives in New Orleans, there was some resistance to the word resilience following Katrina. People were tired and being resilient felt like an additional pressure or one more thing to do. And there was this feeling that they'd been knocked down and they were continually expected to get back up. And they were tired. And so within this discussion of resilience and hope today, I want to give room to fatigue, okay, to give space to hardship without immediately trying to make things better and make the best of it. And resilience as a process, you'll see on your screen, APA defines it as the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress. This moment might fit into any of those different categories for you. Resilience is complex. There's no one perfect definition. It probably exists more in a continuum than someone being resilient or not being resilient. And it really changes over time, depending on individual factors and environmental factors. So you might reflect on some of the short-term challenges in your life that required you to adapt. More long-term or chronic crises can significantly affect the way you operate, and it's certainly affecting the way that we do our jobs, at least right now. And those types of more chronic long-term crises require adjustment. Adopting a resilience perspective helps foster hope by inviting people and their families and communities to notice and to call on the existing strengths and coping abilities that they have and that they can leverage in difficult times, again, without minimizing problems or pain, in order to facilitate that adjustment. And it's not just that some people are resilient and some people aren't. All people have the potential for resilience. And people and families and communities that are resilient use a combination of strengths and resources and coping mechanisms and sources of support to adapt and adjust to stressful events in their lives. And the same is true for kids. In thinking about how to help children through a loss event, it's important that we help them by bringing out those capacities that they have to cope and to manage. Because they, like us, don't exist alone. That requires involving the family and involving school staff to proactively deal with collective crises. So to begin to enable that resilient perspective a bit, I want you to reflect on a few questions. Like before, with us asking you to provide your definition of hope, you might just think for a moment, or maybe you write some thoughts in the chat if you prefer to share with others, whatever feels best for you. You've undoubtedly experienced hardship before, and probably non-identical to this moment, I would imagine, but you've endured challenges and crises. I want you to just take a second to think about what you did in those moments to help you get through those difficult times. And feel free to share if you feel comfortable. I see faith, pray, reaching out to supportive people in your life, compartmentalizing, reaching out for help, which is hard, spending time with family, a lot of faith, research possibilities, turning to support system, absolutely. Thank you for sharing some of those. And I like when people share in the chat, because then you can kind of see what how other people are managing. You've made it to what is currently the final segment of the Stress and Coping series. There's, I think, one day left of school. So you may reflect and ask yourself how you've managed to get where you are despite all the challenges and the hardship brought about by this moment, by the pandemic. The fact that you're here is evidence that you haven't given up. So you might think about how that is, how you've been able to do that. And again, can share in the chat or kind of reflect to yourself. Someone is stubborn. Yes, I like that. That's one of those individual factors. Thinking about the why, take it day by day. It was a struggle, absolutely. Pray and have faith. Talk to someone you trust, family. And then how can you kind of adapt and apply those internal and external resources to the current moment and also looking ahead? That might be another thing that you just reflect on or write in the chat. And again, everyone has the capacity for resilience. It's not about determining if you are or aren't a resilient person, but how you're resilient. And kind of reflecting on those internal and external sources of support and resources that you all just mentioned, that you've used in difficult times in the past can help in planning pathways forward in the future. All right. So in thinking about COVID-19 as a loss event and hope as planning a pathway forward, it may be helpful to learn what others have taken away from loss events in their lives. So the information that I'm about to share on the screen comes from research on post-traumatic growth, but I think it's generalizable to this stressful moment that will be experienced differently by everybody. So the 5 areas that you're about to see are domains that came out of qualitative research with participants who reported transformational changes after a trauma event in their lives. And so again, their growth doesn't change or take away from what happened to them. Rather, the loss event also gave them an appreciation for life, where they could now see the value in simple things that they may have before taken for granted. You might think if this has been true at all for you. They found that they had stronger social relationships as a result of receiving support from others, and also a newfound kind of deeper level of empathy that they had for others going through difficult times. You might think if this has been true at all for you. They found a strength in themselves that they may not have totally recognized before through recognizing that they got through a loss event. They were able to create new possibilities. So when a loss event altered their life path and their beliefs about the world, like Rachel was talking about, they were able to create new ones. And this creation of a new way forward is directly related to hopeful thinking. And finally, they were able to strengthen or revise their understandings about life. So you may have noted some ways that these could also be true for you, and maybe not. So without the pressure of forcing growth in the midst of a difficult time, we just want to provide some strategies that may be useful in creating new possibilities through hopeful thinking.
All right. So like Emily was talking about, we all have the capacity for resilience, and we all have the capacity to develop more hope. So some people have higher hope than others as a baseline, but just how, some people are more optimistic than others. And regardless of the level of hope that someone starts with, we have strategies that we know of that can help increase levels of hope for everyone. And so we're going to share a little bit of those with you today. So one strategy is using hopeful language and self-affirming statements. So we know that thoughts are really powerful because they can affect how we feel and affect what we do. So when we use hopeful language, this refers to really small shifts in how we frame things and how we talk to ourselves and other people, and it can really change how we feel. So for example, the thought, when I finish this task, I can relax with my family, is more hopeful language than the statement, if I finish this task, I can relax with my family. We can also use self-affirming statements, like we talked a little bit about earlier, like I can do this and I will get this done, to encourage ourselves. If we think back to, the definition of hope at the beginning of this presentation, we talked about goals, we talked about pathways thinking, and agency thinking. So another helpful strategy to foster hope is to really sit down and clearly define goals for various areas of your life. So with this, it can be helpful to break down difficult goals into more easily attained sub-goals to make that a little bit more manageable. Another approach to foster hope is to mentally rehearse important upcoming events. So this can help you identify potential barriers and visualize workarounds to those problems. And that helps develop pathways thinking. So for example, maybe you have a goal of repairing a relationship with a friend. You could mentally rehearse what you might say to that person, as well as different ideas of how that friend might respond, so that you can prepare yourself for that conversation. Something else to think about is leaning on your support system to discuss your goals and plans. So research has shown that in group interventions with adults to foster hope, people benefited from really discussing the process of goal setting and achieving their goals with other people. So all of these things don't have to be done in isolation. In fact, it's better if you share with others. So fostering hope doesn't need to be an independent task. Reflecting on what's in your control, especially during COVID-19 and where we are right now, is really important. So when there are so many things that are outside of our control, it can be useful to think about what helps you maintain a sense of control, and what are those things in your life that you do have control over. And then finally, giving meaning to stressful experiences can be a way to foster hope as well. So one way to go about this is to think about the continuity of positive things in your life that are still the same before and after a stressful experience or a loss event like COVID-19. For example, you might think to yourself, well, my family is always there for me, and that hasn't changed. So I'm thinking about what has really stayed the same before and after this really hard experience. All right, so we also wanted to provide you with a brief exercise on self-compassion. So we just talked about some different strategies and the importance of using self-affirming statements and hopeful language, but you might have been wondering how to actually go about doing that. And so we wanted to direct you to this resource by Dr. Kristen Neff called selfcompassion.org. And this is a website that has a lot of free exercises that include like reflections and writing, as well as some guided audio exercises. And one of the exercises that I really like and recommend is called the self-compassion break. And that's a reflection exercise like this one, and there's also an audio to go with it. So I'd really recommend that one as well. But this particular exercise that we're sharing with you today is called identifying what we really want. And this can help address any negative self-talk you might experience and help shift that into more self-affirming language, while also motivating you to make changes to reach your goals. So I'm not going to read this to you, but just to give you the gist of what this is. So the first step in the exercise is really to think about the ways that you use self-criticism as a motivator. So a lot of times we do this so frequently, we don't even think about it. So it's really helpful just to even bring awareness to that and think about how it's hurtful to use that kind of language when you're talking to yourself. The second step is to see if you can think of a nicer and more caring way to motivate yourself to make a change if needed. And so what can help is if you think about a friend, a parent, or someone else in your life, and how they would gently point out to you that your behavior is unproductive, but also encourage you to do something differently. And then the last step in this exercise is that when you do catch yourself being judgmental or using harsh language, just notice how it feels when you use that type of language and then try to reframe it in a more caring way. So when we're thinking about fostering hope in children and adolescents, we can use a lot of the same small changes we just talked about. So really the first thing is modeling, right? Because we know that modeling is so important in how children learn. So one way to help foster hope in children is really just to use your own hopeful language and self-affirming statements. So just by you engaging in that kind of talk, you are modeling high hope for children and encouraging them to do the same. Another way to instill hope in children is that children have to be allowed to set their own goals and then experience those problems encountered in reaching them. So it can be really hard as a parent or as a teacher to watch a child struggle, but it's really important to give them that experience of allowing them to experience frustration and then help them brainstorm solutions to their problems. And this is important because it helps develop pathways thinking. So that second component of hope that we talked about. It can really help them, think about how do I reach my goals and find solutions to my problems. So along with that, you don't want to just have children struggle, right? So we also want to be supportive, and we can do that by praising them not only for their successes, but also for their efforts as they're trying to reach their goals. So using effective praise strategies, like using specific labeled praise for their effort, is a great way in general to support children, as we know, and also to foster hope for them. And then finally, our last strategy for you, you can also encourage children to read books with resilient characters. So whether that's in fiction or biographies about high achieving people or people that overcame challenges. So with your own kids or with your students, you can ask them what challenges the characters faced and how they worked to overcome those struggles as a reflection. So we just went through some kind of general strategies to foster hope. There are also some really specific interventions that have been developed with the purpose of fostering hope. So one of those interventions is writing a hope narrative. So that refers to writing about yourself in the context of goal setting and problem solving. And this can be a helpful exercise to discover hopeful thinking and thinking about ways for how to enhance it. For example, if you write a narrative about something that happened to you or a goal you tried to reach, you may recognize negative self-talk that you were unaware of before. So the second one here, Building Hope for the Future, this is a 5-week hope-based intervention that's been studied with middle school students. And so the goal of that intervention is really to capitalize on those components of hope that we keep coming back to. So helping students conceptualize goals, coming up with ways to achieve their goals, helping them engage in motivation to reach their goals, and then reframing those obstacles that seem really challenging. And this also involves that support system component by encouraging students to share personal hope stories and to plan future steps with a hope buddy. And so when we looked at the research for this intervention, it showed significant increases in students' levels of hope as well as their life satisfaction and self-worth. And then the last intervention we looked at is called Best Possible Self in the Future. And this is a really brief intervention that's been studied and found to be effective with both adults and children with fostering hope and optimism. So this essentially is a writing intervention or a reflection where people are asked to write and think about an ideal future where they've reached all of your goals. And so Emily is actually going to walk us through the details of this now, and you'll have a chance to practice this in breakout rooms.
All right. So as mentioned, we're going to kind of start to conclude by practicing an activity that's intended to foster hope for the future. And like Rachel mentioned, for this activity, we're going to put you in breakout rooms to allow for more discussion if you choose. But before we send you away, it'll be important that I explain the exercise and put it up on the screen so you know what it is. You might, for this, close your eyes, get comfortable for a second, and start the visualization process as I explain it. And if you're comfortable, then you might start sharing components of your vision and brainstorm pathways for getting there with your group members once you're in the breakout rooms. But for right now, close your eyes if you want to. Relax as much as you can. Relax your shoulders. Try to relax your mind. And I just want you to take a few minutes to picture yourself in the future. Could be 6 months from now, a year from now, 5 years from now, wherever your mind goes, whatever you choose. And I want you to imagine that at that time, you're expressing your best possible self strongly. Imagine in detail what it looks like when you've accomplished your goals and you've gotten to the place that you want to be. I want you to try to bring yourself back from any unrealistic fantasies and kind of land on where you want to be that's attainable within reason. Just think about that for a moment more. You may continue to think about it as I move you into breakout rooms. You might begin to write or draw your vision, or maybe right now you settle on sharing it with your group. A really important piece of this activity is to also discuss or write the pathways or steps you'll take to get there. And you can share whatever you feel comfortable sharing with your group. And then we'll come back and list off some final resources and takeaways. But for now, let me see that I can successfully do a breakout room. Let's see. Okay, how about we do, I don't know, Rachel, you think 10? 10's good?
Sure.
Okay, taking that as affirmative. That's going to be about 15 to 16 people per room. So I'll go ahead and create those rooms. I don't know if you all, maybe you've got your vision down. You can always take a picture of the screen if you want to remember what it is I was just saying. And then I'll send this out and you can click join when you're ready. All right. So here we have an example of how to do pretty much that same activity with youth. And I don't know, it might be a bit small for you to see on your screens, but at the top, there's a script where you can have youth think about their lives in the future, imagining that everything has gone as well as it possibly could. They've worked hard and they've accomplished their goals, and having them kind of visualize and then talk about what's that look like. And they can draw or write in that box there. And then you can see at the bottom the bullet points. They can write or they can list the pathways to reaching those goals. Here we have some books and curricula related to fostering hope. I know that Greater Good in Action from Berkeley also has some resilience to stress online resources if you'd kind of prefer quick free online resources to a book or a curriculum. Again, that's Greater Good in Action from Berkeley if you want to Google that. You could also Google Compassion Resilience Toolkit.org for resources related to staying resilient during COVID-19. Again, I know these aren't on the slide, but Compassion Resilience Toolkit.org is another one that may be helpful. So thank you all for attending this final presentation of the series. These are just some final takeaways about how hope is defined, how we can kind of reconstruct our life narratives related to the future through engaging in hope and resilient focused strategies. So I'll check the chat one last time. Is anything coming in there, Rachel, that you're seeing to address before we kind of wrap up?
It looks like Norma wanted to share a little bit about her future vision. So thank you for sharing that. But it looks
Oh,
like you
did
don't
you
have
put
any
in?
more questions. Yes.
Awesome. All right. Ta-da. That was a little dramatic. Had to do it at the end. So we're going to share with you the QR code that you can use to get to the Google form for PD credit in the slide just after this one. And you can hold up your camera to the screen and your camera should just recognize the code and take you to the form. For those that don't like that process, we'll also throw the link in the chat for you all. And again, just thank you for taking time out of your day and talking with us about ways to foster hope during difficult times. So I'll go ahead and throw up that QR code and we'll also put the link in the chat.